Hi, JJ here. I picked 4 questions off the list. First one, what responsibility do I have to involve the family in care and how might I accomplish this? I'd make sure the family feels supported and knows where to seek additional information if they need it. I would educate them in the care process of the patient. I'd educate them on their condition and what it would entail for care. Such as the patient's nutrition and meals he'll need, emotional support, medication management, this person's diabetes, the antibiotics he's on, educate them about that, the pain meds, and also caring for his wound vac. And I'd also educate them on doing some range of motion exercises, which usually PT will print off on a piece of paper to take home for them to do. I would also make sure the family actively listens to what their patient says and be as encouraging and supportive as they can be, make their patient comfortable through this whole healing process. And my next question, how might care and outcomes be affected if some of the healthcare team members were not involved in the care of this patient? Well, the patient probably wouldn't heal as fast or as healthy in his recovery. We need the whole healthcare team, members of it, to collaborate and work together for an optimal recovery. For instance, without PT, the patient might lack the correct exercise therapy to strengthen his calves and also get the needed hardware or ambulation devices to be able to walk comfortably again. The pharmacist, we need his medication expertise to know the correct meds, and the patient will need this through his recovery, so there'll be less medication errors. Also, dietitians play a part of the team with their medical nutrition, and social workers provide counseling. They determine other appropriate healthcare services or needs for the patient. The special training of a wound care specialist for this particular patient to ensure his foot heals correctly. Also, a nurse is a big part, probably the biggest, but the nurse assesses, intervenes, administers medications, inspects and cleans the wound, takes their vitals, performs treatments, and educates the patient and his family. Let's see. Another question I had was, if the patient was admitted to a skilled nursing facility, how might this benefit the patient and what challenges might this patient face? Well, the benefits are 24-hour-a-day care. They'd have in-house physical therapy, possibly occupational therapy, social worker, nurses, other trained medical professionals. The nurses manage their medications and take care and monitor his wound vac and monitor his foot. And he'd also have balanced nutrition, and his family could come and visit. And his family would also have peace of mind that he was safe and comfortable and well cared for. But right now, a challenge would be obviously the coronavirus, and the family would not be able to visit him at the skilled care facility. So there would be a lack of social interaction. Also, a possible challenge, the facility could be short-staffed, and they may not answer the call bell immediately. Personally, I love working on the skilled unit. It's the most enjoyable because I love watching people get better and go home. Okay, my next question was my 3 main concerns, priorities regarding care of the patient from my profession's perspective. One, well, if this patient was sent home with a wound vac and IV antibiotics, I would want some home health care for this patient to ensure that this plan of care is being maintained and the IV and wound vac are working correctly, and that his pain management's being correctly administered. Another concern I would have would be how the patient's sleeping, if he's being repositioned, as to not get skin breakdown, especially with his diabetes. He might have peripheral neuropathy and not feel it. I'd also be concerned for infection. I mean, he had a toe amputated and he's on wound vac. He might not have sensation. But yeah, again, if the home health care, that would be a big thing. And that's all. Thank you.